Hello everyone, we are from Group 1 would like to present about the journal article that we picked entitled English for Doctors and ESP Approach to Needs Analysis and Course Design for Medical Students by Muhammad Arfan Lodi, Mahwish Shamim, Mahwish Rabab, Syed Huram Shahzad and Abida Ashraf. Before we do so, allow me to introduce myself first. My name is Khalil Nursham bin Muhammad Rafiq and I will be the first presenter for this video. Let's talk about the introduction of this journal article. According to the author, English is still playing a central role in education all over the world. English language has gained the status of international language and also the second official language in Pakistan. Besides that, English also has become the language of science, media, and technology. Pakistan is a country in which all medical literature is published in English. English language in the medical field is important for students' academic purposes, such as in reading textbooks, searching material from the internet, in presentations, taking the examination, doing interaction with teachers, and further studies abroad. Alright, now, what is the purpose of the study? The first one, it is to explore the English language needs of medical learners. Second, it is to design a course to meet the needs of the medical students. And it is also to determine the communicative needs of doctors and medical professionals in their field. Moving on to the research objectives. First, it is to find the English communicative needs of doctors in the academic settings. Second, it is to investigate the English language needs of doctors in their professional career. Third, it is to examine the existing level of proficiency in English skills among medical students. The last research objective is to identify what ESL course can be designed based upon the information gathered during the present study. Okay, let's now proceed with the research question.
Hello guys, I'm Aisha. Now I'm gonna talk about the analyzation for our research question. Number 1, what are the English language needs of medical students in their academic activities? For this question, it is about the necessity of English language for medical students in their academic interest. Number 2, what are the English language needs of doctors in their professional career? For this question, it is about the necessity of English language for doctors in their professional field. Number 3, what is the existing level of proficiency in English skills among medical students? For this question, it is about medical students' current proficiency level in English skills. Number 4, what EMP course can be designed based upon the information gathered during the present study? For this question, it is about what kind of ESL course can be designed for in medical students. Okay, next, I'm going to talk about the participants. First, let's look at the place of choosing samples. First one, the samples chosen from the Sheikh Zayed College, and the second one is Hospital Rahim Yakan. Okay, right now let's look at the quantity of participants. They chose 200 students from MBBS and 20 doctors from Hospital Rahim Yakan. Last one, what they did. For students, they analyzed the English needs in their academic and their future career. For doctors, they analyzed the professional linguistic needs.
Hi all, my name is Fatin and I'm going to talk about instruments. So first of all, instruments is the device that used to collect data for the research purpose. So for this research, the researchers used two separate questionnaires. The first questionnaire is used to gather information from medical students, while second questionnaire is used to gather information from the doctors. Next, the main objective of these questionnaires is to explore the English language needs of the medical learners and the learning designs to meet their specific needs. Let's proceed with the process of the data collection. The first one is descriptive method. In this method, it describes the characteristic of the samples. In addition, it also precedes the explanatory research. It also describes the features and the data which explain the events, and then the collected data will be organized and tabulated. Visual aids such as tables, charts, and graphs will be included as well. The next method is mixed method approach. It consists of quantitative and qualitative methods. The function of this method is to keep in view for the difference consideration. Let's move on with the process of the questionnaire constructions. The first step is to gather information about academic and professional activities of the medical students. The next step is to read the literature and previous research. Thirdly, inventory was developed. The fourth step includes pilot testing phase. In this phase, all details are made to be valid and reliable. Finally, the questionnaires were created.
Hi, my name is Amira and I will discuss about data analysis. The questionnaire given to the medical students has 6 sections, which are demographical information, significance of English, necessities of the language skills, analytical information, learning needs, and lastly, lacks and wants. The first data is the significance of English. English language is rated as highly vital at academic level, at professional level, and for understanding medical terminologies. Majority stress upon the need of English language course which could fulfill their academic and professional needs. The second data is the usage of the language skills. The purpose was to know the opinions about using and learning English language skills. Vast majority of respondents opine that they use English language in their daily conversations. Some respondents disagree and others strongly disagree to use language skills in medical settings. The third data is intended to identify the existing proficiency level of medical students in different language skills and factors. Based on the table shown, it denotes that the majority of the medical students rate their language proficiency at average level. Lastly, the fourth data is aimed to identify the opinions of medical students about their lacks and wants regarding English language learning. Students quite often fail to communicate well about medical reports. Problems developing good understanding about English books, case histories, and lectures are maximum among students.
Hello everyone, I am Ifa Elina and today I'm going to talk about results and discussion. The first question is, what are the English language needs of medical students in their academic activities? Based on the findings, most of the respondents agree that English is important for medical students. They also think that EMP is crucial for medical discourse community in Pakistan. Different academic activities such as following instructions during lecture, discussion on medical cases, and others are the overall findings. English for medical purposes should start from the first year. The second research question is, what are the English language needs of doctors in their professional career? Based on the findings, most of the doctors state that English is important for medical students. Many professional activities such as reading medical materials, interacting with foreign patients, and others are the overall findings. English is the official language for medical representatives in Pakistan. EMP is very vital in the medical field. The third research question is, what is the existing level of proficiency in English skills among medical students? Students' proficiency of listening skill 52.2%, speaking skills 71%, and writing skills 60.5%. Their existing proficiency in English vocabulary is 78.5%, English grammar is 80.5%, and comprehension of medical terminology is 73.5%. Apart from that, respondents state that difficulties faced to speak English usually happen at seminars and conferences. Extra English language classes should start for students who have difficulties in English. The last research question is, what ESL course can be designed based upon the information gathered during the present study? Based on the findings, respondents state that EMP should start in medical college. They also suggest problem-based learning. Medical terminology, vocabulary, and communication skills should be inserted in the course content. The aim of learning English at their level is to use the language for medical purposes, not to learn about English grammar or other English structures. Most of the medical knowledge and skills should also be gathered by medical students.
Hello guys, my name is Aisha. Now I'm gonna make the conclusion for our presentation. The data provided from medical students and the doctors are the finding of the study. And the aim of study is recognize medical students and the doctors' language needs. Moreover, they have certain reasons to study English for medical purpose, such as academic and professional settings. And they have encountered problems with communication skills. Hence, it is important for them to improve their English proficiency skills.
That's all from us. Thank you for watching.